All right, thank you all for coming this morning and joining us at Campbelltown Hospital. It's been an exciting morning and I'm here joined by Dr. Kerry Chant, our Public Health Officer here in New South Wales, the Health Minister, Brad Hazzard, Education Minister Sarah Mitchell, Dr. Michael Maley, the Director of Pathology, as well as our local members, Melanie Gibbons and Peter Sidgraves. So today we had a great tour this morning. Dr. Michael Maley gave us a tour of the new pathology lab here at Campbelltown Hospital, which has doubled in size. It's been a substantial investment here in Campbelltown Hospital. In fact, I remember being out here many years ago as Treasurer in my first budget, where we announced a $632 million upgrade of Campbelltown Hospital, which now takes the investment at Campbelltown Hospital to $800 million. And that investment began many years ago. And today, to tour the new pathology lab here that's doubled in size, thousands of tests occurring every single week right here in New South Wales, has occurred because of our investments over time. We've invested $10 billion in building hospitals and health facilities right across the state. Since 2011, 170 new hospitals and health facilities have been built, and currently there are 110 under construction right across New South Wales. And that is because we've invested substantial amounts over a significant period of time. And whether that's here in southwest Sydney, a substantial growth area here in our state, or in Western Sydney, or Tweed in the north and Bega in the south, right across New South Wales, we are ensuring that people have the health care they need for when they need it. And you can't just turn that tap on in a pandemic or when you come across challenging health times. It's that investment over time, the strong financial management here in this state that has enabled us to invest record amounts right here in southwest Sydney. And as Premier now to come back to see, and I still recall that first budget coming out with the Health Minister, Brad Hazzard at that time, that incredible investment to now see right around us this hospital come to life is incredibly pleasing and reassuring for people in southwest Sydney, a substantial growth area. As our local members know, many more people calling southwest Sydney their home, and we've been ahead of the game investing record amounts in our health system. As you'd be aware today, as we do every Friday, we also release how we are tracking in relation to our modelling here. And it's pleasing to see in relation to hospitalisations across the state, they are down around 200 from last week. ICU presentations are down more than 20 since last week as well. Once again, just on the back of that health investment, we are operating well within capacity. It was incredibly pleasing to bring forward the date that we had for bringing back non-urgent elective surgery here in our state, bringing that back before other states are being able to do so. And that's because that investment, as I've spoken about, in our health system over 10 years here in our state has substantially increased that capacity. And I think it should be very reassuring for people across New South Wales, these numbers today and where we are tracking in relation to hospitalisations and ICU presentations. I also want to acknowledge our teachers who have ensured that our kids have got back to school this week as smoothly as could have been possible. I want to thank the Education Minister Sarah Mitchell for the work that she has done. We set out to achieve this goal many weeks ago. We know that kids need to be back in the classroom on day one, term one. We achieved that. I know it has been a substantial effort, not just on behalf of our teachers, but our parents as well. And I want to thank all our parents who have had to go through and do those RAT tests. I know it's been a challenge. I know it's required effort, but it's incredibly important that we do everything that we can, not just on an educational, from an educational perspective, but from a social outcome and mental health perspective, to have kids back in the classroom. And I think, given the challenges we were facing into over the last few weeks, it's been an incredible effort right across the board, from our teaching staff to our Department of Education and Health staff and our parents, who have ensured that we've been able to get kids back in the classroom as safely as possible to start the year. So it's been a big effort, and I want to thank everybody for what they've done, and it's been a major achievement. Finally, before I pass to Dr. Chant to give a public health update, I do want to once again urge the community to continue to make those efforts and get boosted. We're currently around 45% of the eligible population across New South Wales who has been boosted. Can I thank you for the efforts over the last 2 years and the sacrifices that everyone has made. But it's incredibly, incredibly important that we keep that effort going. We really need to get that booster shot number up. So if it has been 3 months since your second dose vaccination, please go and make an appointment. It has been key to keeping you, your friends and your family safe. We have 40 centres across the state, in addition to the pharmacists and the GPs. But I know everybody's made a phenomenal effort. It's been a phenomenal effort to have one of the highest vaccination rates, not just in Australia, but around the world. Now, that hasn't been the government that's done it. That achievement is because of the efforts that people right across our state have made, from the cities to regional and remote New South Wales. It has been a phenomenal effort, but we need to just keep that effort going as we move through this next phase. It is very clear, incredibly clear, from the evidence that we see both in our health system here in New South Wales, the health systems across the country and around the world, that booster shot, that third shot ensures that there is a lower level of hospitalisations, ICU presentations and death. Boosters are key to keeping you safe. Can we please just continue that effort? I know governments, not just here, but around the country and around the world have asked a lot over the last 2 years, but this effort needs to continue. Making that effort will keep you and your family safe. But I want to thank everybody for everything they've done over the 2 years during this pandemic. There's one last effort everyone needs to make to keep yourself and your community safe. I'm now going to pass to Dr. Chant to give a public health update. Then Minister Hazzard will reiterate those health messages and talk again about this phenomenal construction here of Campbelltown Hospital and what it actually means to the southwest community who will benefit from this upgrade. As we know, the clinical services building will open later this year, and the entire redevelopment will be complete next year, and Minister Hazzard will speak to that. Minister Mitchell will follow Dr. Michael Maley, will give a bit of a sense on the work of the pathology here at Campbelltown Hospital and how that will benefit the local community, of which he's very proud and showed us around. And then Minister Mitchell will wrap up in terms of giving us an update of how the first week of getting kids back into school has gone.
Thank you, Premier. So currently we have 2,494 people in hospital, including 160 people in ICU, 75 of whom are ventilated. There were 10,698 positive test results returned, including 6,122 positive rapid antigen tests and 4,576 positive PCR tests. Those PCR tests, those 5,576 positive PCR tests, were from around 39,349 PCR tests. So the data we release on Fridays, we release the updated modelling data which is attached, and it is pleasing to see that we are seeing declines in new hospital admissions. ICU is also declining. You will note that the number ventilated does still remain at a more constant level, and we expect that to be a little bit slower in declining because a number of the patients have got longer length of stays in ICU when they are ventilated, but we will see that number come down as well. The health system continues to be working very hard, and when I say the health system, I mean the GPs, the pharmacists, the allied health professionals, the public hospitals and the private hospitals. They're doing lots of tasks, and I just want to acknowledge the great work they're doing, particularly all of the efforts to provide health care to all people and also roll out the booster program. The Premier's indicated the importance of that. I'm going to talk a little bit later on about the death summary that I do provide, and again that has some salient messages for people emphasising the importance of vaccination and booster doses. Today we're announcing the death of 31 people with COVID, 21 men and 10 women, and can I express my condolences to families for their losses. Of the 31 people who died, one person was in their 60s, 7 were in their 70s, 12 were in their 80s, 10 people were in their 90s, and one person was aged 100. In the period Friday to the 28th of January to the Thursday the 3rd of February, we've had 253 deaths, 1 person in their 30s, 4 in their 50s, 18 in their 60s, 50 in their 70s, 108 in their 80s, 68 between 90 and 99, and 4 over 100 years of age. 136 were aged care residents, and of the 253 deaths, 52 were unvaccinated. 6 had received 1 dose, 149 had received 2 doses, and only 46 had received 3 doses. So the vast majority of those over age 70 had not had their booster, and overall only 18% of all of the people who died had had their booster, despite the older age profile and the underlying health conditions. There were 13 deaths in the period for those under 65 years of age, and 1 person was in their 30s, 4 in their 50s, and 8 were in their early 60s. 10 were males and 3 were females. 4 were unvaccinated, 1 had had 1 dose, 7 had 2 doses, and 1 had had 3 doses. And the person with the 3 doses had a very severe existing immunocompromise. So just to give a sense of the comorbidities, or what we talk about is the underlying health conditions, you'll see this matches the information I've provided previously. 6 people had diabetes, 4 were obese, 4 had cardiac disease, 3 had significant immunosuppression, 2 had renal disease, 1 had severe liver disease, and 1 had a cancer, and 2 had obstructive sleep apnea. So clearly what this highlights is that those that are elderly and those that have underlying health conditions are most at risk for severe disease, hospitalisation and death. But the other salient message is that boosters are effective, and I would urge everyone, particularly those with underlying health conditions and those that are elderly, to really, as a matter of urgency, get boosted if it's 3 months since your 2nd dose. And for some of those individuals with immunocompromise or undergoing chemotherapy, they will require 4 doses, 3 doses as part of the primary course and a 4th dose. So please, if you have chronic underlying health conditions, check with your GP and pharmacist, but you may require 4 doses to have completed your schedule for vaccination. Thank you.
Thanks very much, Dr. Chant and Premier. Look, it's just a privilege to be here in the southwest, here at this amazing facility at Campbelltown Hospital. The entire area here is just, it's a crucible of health facilities. So we're standing in front of the Macarthur Medical School, which I opened just a few years ago, and as the former Treasurer and Premier said, he's been out here now a number of times, first to deliver the money as Treasurer and now to see the outcome of all of the work that's gone on here at Campbelltown Hospital. To see what $800 million can do, it's a lot of money, but it's doing the most magnificent job of bringing 21st century health facilities to the southwestern population, a growing population. Our government has been very committed over its decade. It's effectively been a revolution in healthcare provision in the last 10 years under the Liberal National Government. Doesn't matter whether you're in the Tweed, $600 million hospital up in the Tweed, whether you're at Tamworth, Dubbo, Mudgee, Bega, the new South Eastern Regional Hospital, whether you're down in the Eurobodalla, where we're building a brand new level 4 hospital in the Eurobodalla at Maruya. There are new hospitals going up all over the state, but the southwestern and western part of Sydney are the major growth areas, so there's been a lot of focus from our government on that. And I want to acknowledge the role of local members. We're here today obviously with Mel Gibbons, the member for Holsworthy, Peter Seagraves, member for Camden, and of course there's also another member who couldn't be here today, Greg Warren. Everybody has advocated on behalf of their communities to make sure that the funds come where the community has come. And so we're making sure that as a Liberal National Government we are delivering. I want to thank Amanda Larkin as the Chief Executive here in southwestern Sydney. She's also been a driving force to make sure that so much of the focus of getting the absolutely 21st century best health services can be delivered, and she has been part and parcel of that. Thank you to Health Infrastructure. Bruno is here somewhere. Thank you, Bruno, for all the work your team have done. Thank you to the medical staff here in southwestern Sydney who are so excited about what has happened here and is continuing to happen here with $800 million worth of taxpayers' dollars delivering world-class medical services. But it's the staff that make the difference. Obviously Dr. Michael Maley has just taken us for a tour through the brand new expanded pathology facilities. COVID hasn't been wonderful for the community, but it has been amazing in the sense of putting a focus on pathology services and on infectious diseases and the type of services that we as a community need to have. And we are determined as a Liberal National Government to make sure that in every part of our state we have the very best pathology services. Southwestern Sydney has now got the most incredible facilities, not only in Liverpool but here at Campbelltown Hospital. I'm going to ask Dr. Maley in a moment to talk about some of those, the outcomes of those facilities' growth here in Campbelltown. I want to thank the pathology staff who've worked flat out now. They worked very hard anyway before COVID arrived, but they've also gone flat out in the last 2 years. We thought we were doing well. I remember, Michael, we had about 40,000 tests being done a day back in March, April of 2020. And with the amazing New South Wales Pathology Services, Michael Maley is the Director of the Southwestern Pathology Services, we managed to get up to almost 200,000 tests a day. It was challenging, it was excruciating at times, but between the state pathology, New South Wales Pathology Services, and the private services, we really have made a huge difference to making sure that our community was kept safe. Finally, I just want to say this, that there is no doubt that we all expect and we demand that we have 21st century health services here in New South Wales. The Liberal National Government has made that the focus. It is the hallmark of our decade in office. Appropriate economic management, making sure we have a strong government delivering the best health services. And here today we stand in front of an example of that amazing capacity to build new health services. So thank you to the Premier as a former Treasurer for giving us so much money to do it, but also I think to the community, I hope you enjoy these amazing new services. Now I'll ask Dr. Maley just to say a few words about, we've seen it, the Premier and I just saw the excitement of the staff, the staff in the new facilities, but perhaps Dr. Maley could just give us a few words about what is actually going to be delivered through the new pathology services here at Campbelltown Hospital. Dr. Maley.
Thank you, Minister and Premier, Kerry Chant and other members. Thank you very much for giving me the opportunity to showcase our new laboratory. We've really enjoyed being able to show off the fantastic new facilities. I just start by acknowledging, as the Minister did, the great work that our pathology staff have done over the last 2 years, particularly being able to maintain life-saving testing whilst we've had all of the COVID testing on top of that. So they've done a fantastic job. And on top of that as well, they've basically designed and fitted out the new laboratory. So they've done a fantastic job. And the same would go for pathology staff statewide. So I acknowledge that. So Campbelltown, as you've seen or you've heard, is a very rapidly growing area, and our hospitals are growing very fast because our population is growing fast. Our laboratory workload is growing by at least 10% every year, which may not sound like a lot, but for a pathology lab that's a huge amount of growth. And with that, there is more complexity. The hospital is treating much sicker patients. They're bringing in new services, and all of these things require an enhanced pathology service. A lot of, probably 70 to 80% of all decisions in healthcare are made on the basis of a pathology test, and it really is important that the tests are accurate and timely so that we can deliver high quality care. The Campbelltown laboratory, as the Premier said, has doubled in size. and it's given us an opportunity to bring on site pathologists. We hadn't had pathology experts on site before, but what they bring is that they value add to the pathology testing, so they help with the decisions about what is the best test to answer the clinical question that the clinician's asking, and they also help the clinicians interpret the results and optimise the management for the patient, the personalisation of the pathology results. So it's really exciting that we're being able to bring pathologists on site to Campbelltown to interact with our clinicians and create a vibrant clinical environment here, which is what the people of South West Sydney deserve. It also gives us an opportunity to support research, and we're standing in front of the clinical school, and there's going to be a big new research institute as well here. And again, pathology underpins a lot of the research, both clinical research through data analysis, but also research into new biomarkers and testing. And the pathology lab at Campbelltown, the expanded lab, will be able to support the local clinicians answering those clinical questions through research. So that's very exciting, and that will be something that will develop over time. The other thing that we've been able to do by expanding the laboratory is to bring in a lot of new equipment and duplicate a lot of our equipment. So when you are servicing a massive hospital like Campbelltown with very high throughput of patients and demands for urgent testing, you can't afford for your equipment to break down or to need to be serviced. And so what we've been able to do is to duplicate our equipment, bring in new equipment, so it not only increases the capacity but also gives us that redundancy that allows us to continue our services without having to send our samples elsewhere and maintain safe and quality care in our hospitals. And I guess lastly, the other thing that really is exciting about the redevelopment in general, but also about pathology, is it gives a lot of opportunity for local people who are interested in having jobs in science and technology. All sorts of jobs are required to run a pathology service, whether it be scientific and technical jobs or logistic jobs or customer service jobs. All of these sorts of jobs are going to be available for our local people, and we've seen through COVID that there are a lot of young people that want to move into pathology. So this will give them a great opportunity in the southwest to find local jobs in their facilities. So that was really all I wanted to say.
Thank you. Minister.
Thank you, Minister. Well, good morning, everybody. Here we are at the final day of week 1, term 1 for the 2022 school year, and I think for me, as Minister, I'm so pleased with how this first week has gone. Obviously, it's not a time to get complacent. We know that there may well still be bumps along the way when it comes to our education system, but having said that, I really couldn't have wished for a better start to the school year. I also want to thank all of our school staff, our principals, our teachers, our school administrative and support staff, and also our parents and students who have really adapted well to the new way of how we're living with COVID and managing it in our school communities, and in particular the usage of rapid antigen tests. So we are starting to get some initial data, which I'm going to share with you today, that gives us an indication of what these tests are picking up. I'm also happy to be able to share with you that our school attendance rates have been really strong this week. So as of yesterday, we had 86% of our students across the state at school, which is fantastic, particularly given that schools in the Western Division don't start until next week, and also many of our kindergarten students are having a staggered start to their time at school. So I expect that data to be even better next week, and that's really exciting and encouraging, because it tells me that parents have confidence in the systems that we have in place in our schools and that they're working well. I'm also happy to confirm that no schools have had to cease operations this week. Again, a marked difference from where we were towards the end of last year, and again reflects the new way that we are living with and managing COVID in our school communities. I do have some preliminary data in terms of the number of students that we've been able to pick up across the systems with rapid antigen testing over the last week. 2,417 students have reported a positive case during that period. At the moment, we don't have the breakdown of primary versus secondary students. That data will come next week through Service New South Wales, and again, we'll be happy to share that with you when it becomes available. And in terms of our staff, I have some data from our government schools. We've had 617 staff test positive across 438 schools. But again, we have been able to manage those staffing absentee rates with the programs that we've had in place. So our schools have been able to use casual staff, they've been able to call on existing staff within their schools to cover those classes. At this stage, we haven't had to use any of our other resources that we had in place, including final year university students or any of our department staff. The vacancies, when staff do have COVID, is being managed really well at a local school level. And again, I think that's very encouraging. It shows that the work that we've done and the systems that we have in place are there to support our students and keep our schools operational, which is obviously a priority number one. Just lastly, in terms of our rapid antigen testing, obviously we've committed to doing that for the first 4 weeks of term. We've had the first fortnight go out and parents have collected those, but we are of course still hard at work at our warehouse in Western Sydney. We're now up to about 17.5 million rapid antigen tests that the Department of Education has and is distributing out to schools for that second lot of testing in weeks 3 and 4. Again, parents, I just ask you to keep an eye out on information that will come from your school and principal in terms of picking up your next lot of RAT kits for your children, likely to be towards the end of next week. That information will be made available to you in a similar way that it was when you picked up the first lot for your children. And finally, I just have an ask of our parents and our school communities. We're also going to be conducting a survey that will go out to schools from today, and we're asking parents to let us know, very short, sharp survey, it's about 7 or 8 questions, but just what their experience has been with rapid antigen testing. Are they using them at home? What are the reasons why? If for any reason they're not, again, what is the reason or rationale behind that? Just so we can get an understanding of parent sentiment in terms of how we're managing the use of RATs and how they're finding it with their children. We're also going to be sending a similar survey to our staff, again just to collect that data. As we've said all along, we will make some decisions within the next week or two about what will happen post week 4 and what we'll do with our rapid antigen testing systems in schools. So this is just some more data that we'll be able to use, along with of course advice from New South Wales Health and other considerations. So parents, keep an eye out, however you would normally get communications from your school, whether it's through an app, Facebook page, an email from the principal. If you have a few minutes to spare to provide us with your insights, that will be really useful in determining where we go from here. Thanks.
4 questions. I was remiss of me not to acknowledge Amanda Larkin, the head of the local health district here, and I don't believe this would have happened without you and all the work you put in. I remember meeting you 5 years ago. Governments do small projects, big projects. This has been a massive project, and you think, former treasurer, that these are big dollars that go into $800 million, but to see this hospital come to life before our very eyes is incredibly pleasing, and the dedication and the work of you and your entire team has really ensured we've been able to get this off the ground, so well done. Questions?
Premier, there's likely many more COVID cases than the know. Queensland are introducing some random COVID testing to try and get an idea of what the numbers are actually like. Do you have any thoughts on that or implementing that in New South Wales?
Dr. Chant.
I think we've spoken about the fact that one of the pieces of the puzzle we don't know is just what is the proportion of people that have actually been infected, because we know that not everyone will have symptoms. People might brush off their symptoms. Some people will have used RATs before they're able to record them. So we are doing, I'm aware of the work that Queensland is undertaking, and that's a small scale study where they're just PCR testing a random group. We're actually looking at a sero survey. That's where you collect blood and you look for whether people have been infected. So we're pursuing and working collaboratively across the nation on how we can collect this information, because it is really important to modelling, and we are progressing that work collaboratively.
Based on the modelling today that we've been given, it doesn't seem to be whilst we've fallen under the worst case scenarios, right now it doesn't seem to be, the curve doesn't seem to be coming down as quickly as what we may have hoped. It's flatlined to some extent. I'm just wondering whether that's got anything to do with the booster take up at all.
Look, we know the forces that are pushing down transmission in the community is when people acquire the infection, they become immune for around 4 months after they're unlikely to be reinfected with. If they've got Omicron, they're unlikely to be reinfected with Omicron for 4 months. That reduces the risk of ongoing transmission, and the booster rollout is a really key strategy, as well as the behaviours that individuals take in protecting themselves and their loved ones in those COVID-safe practices, indoor mask wearing, etc. The exact combination of how each of those factors is playing out is unclear. But in terms of the numbers, I think there's a few reasons why we're not seeing the decline. I think that we still clearly have evidence of slowing the spread of it, and we know that because we're seeing that new admissions to hospital, new admissions to ICU are decreasing. We're seeing the positivity rate in the samples going down. We're seeing staff absenteeism and furloughing going down. I suspect that there are a couple of factors playing into this, including the fact that this will pick up some people that are incidentally admitted to hospital with COVID, so for other reasons. And that's one of the important roles of doing these other special studies to further understand that. But it may well be that this curve is a little bit flatter because we've blunted the peak through our action, and then it will gradually taper off. The question is how low it gets, and what our sort of baseline level of transmission in the community will be. Does that address your question?
Do you fear though that the take-up of boosters is, I guess, not like the low take-up? New South Wales has one of the lowest take-up rates of boosters in the country. So do you fear that we need that booster rate to go up in order to bring the ICU numbers down?
I can't be clearer. We need the boosters because that's the best decision that you as an individual can have, regardless of what I want from a population perspective to slow the spread. A booster protects you. And I've made it very clear that for Omicron, you need to consider 3 doses as being up to date, and for some people 4. So there's no doubt you need the 3 doses, and anyone who is feeling that 2 doses is enough is incorrect. The science is very clear on that. In terms of the rollout of the vaccine, it's also important to note that we boosted a large number of people at a point in time, so we'll have a large number of people eligible at a particular point in time, and you'll see that number jump around from state to state because of the way in which the vaccine programs were rolled out. And those numbers will change again when we add the 16 and 17-year-olds who have now become eligible. I just can't urge the community more strongly to please get a booster. We know throughout the year there may be additional doses required, but I can't be clearer. 3 doses is what most people need, and 4 doses may be required for some.
I'll just add to that. I think what's important here is positivity will take people with us, not negativity. And we have a record vaccination rate here in our state, one of the highest anywhere in the world at 95%. Now, we need to get that booster shot rate up. We need people to make those appointments. We need to get it higher than 45%. But what we're releasing today is incredibly pleasing. The facts that you look at the scenario modelling that we did, when you look at the ICU capacity, well within capacity, tracking within, we look at the best case, we had a number of scenarios that we released last year, best case, a middle case and a worst case scenario. What we've achieved here in New South Wales by the efforts that everyone has made, by the sacrifices and the sustained efforts of our health workers right across the state, from the cities to the bush, has been phenomenal. And that's because of the vaccination rate here in our state. When we look back at where we were at some points with furloughed workforce here in New South Wales, was around, of our health staff, was above 6,200. That's now below 3,000 here in New South Wales. So these are very pleasing signs in terms of where we sit today, both on ICU presentations and hospitalisations. The other difference I'd make as well, compared to Alpha and Delta, when you're in a lockdown situation, you had less people out and about, case numbers would come down. What we're seeing here in our state, as we remain open, getting kids back into the classroom, keeping businesses open, not going into lockdown, means yes, those numbers will come down. There may be further waves as we move forward throughout the year. We've always said that with schools going back to school, but we are seeing a plateauing in case numbers. That will then result in a plateauing, as we're seeing in a reduction in hospitalisations and ICUs across the board. But I think, as we've said, releasing the facts to the public, so it's very, very clear about what the situation is in our health system. I think we can all see today, based on the graphs that we're presenting, that we're heading in the right direction. And we always said we'd come through this period of time stronger. We've done that. Vaccination has been key, and that's why we continue to ask people right across our state, wherever you live, if you haven't made a booking, please do so. And if you have had COVID, please go and get that booster shot within 4 to 6 weeks.
Minister Mitchell, can I just ask, with regards to the draft national curriculum, what do you think of the proposed changes, and particularly about the study of Western and Christian heritage?
Yeah, I mean, well, obviously education ministers from around the country are due to meet this afternoon to discuss a range of issues, including the national curriculum, so I look forward to having those conversations with my colleagues then, and I don't want to preempt that too much. Having said that, certainly from where we were with the initial draft curriculum, for us in New South Wales, our main concerns were around some of the content in the English and maths syllabuses, particularly in English, making sure that there was a strong focus on phonics, as we are doing in our New South Wales curriculum. We know that that's the best way to teach children how to read, and we want to make sure that's firmly embedded in the Australian curriculum as well. Also some concerns around the maths syllabuses, and again some of those core skills and concepts, things like learning the times tables that had been pushed back, we want to see that brought forward, and again the initial discussions around that have been pleasing. I think when it comes to the history curriculum, I think New South Wales takes a pretty common sense approach. We think it's important that our students understand all of Australia's history, that we understand and respect all our cultures, and whether that's from our Christian and Western heritage, our Indigenous heritage, and everything that's happened since. So as I said, these are the conversations that we'll be having as education ministers this afternoon, but I think it's about getting that balance right.
Minister, you said that at the moment that schools have been able to use table staff in covering classes, and that there isn't a teacher shortage. The principal of Cromer High has reported having to close early on a Thursday because he doesn't have enough teachers and he's facing constraints in the staffing budget. Have you heard of that, and have you heard of other schools maybe shortening hours of classes in order to cope with their staffing situation?
So in relation to that particular school, the advice that I have is that was actually a decision made by the school community late last year. I think parents were surveyed and there was community consultation about adjusting that Thursday, and during that time staff are going to be using that for regular planning time and also some additional professional development. That particular school has a significant staffing budget. My understanding is that there is only one permanent position that is vacant at that school. So to be honest, I don't really understand that messaging that's come out from that principal. It's not consistent with the advice that I have in terms of the staffing that is available to them from their budget. And again, my advice is that this was something that was consulted with the school community last year, and the decision was made to do that on a Thursday.
What is it that schools have to alter their timetables, perhaps start early? And that's definitely happening.
Yep.
High school coming in before 9 because they don't have enough, say, science teachers in particular. How much of that is going on, and how much of that is affecting, in particular, Year 12?
Yep.
And add to that, from your perspective, is it imperative, in particular, that Year 12 is the ways we found to make sure they're not affected?
Yeah, look, absolutely. And the reality is we've got more than 2,200 public schools across our state servicing different communities. It is not uncommon for schools to have different start and finish times, to stagger their start and finish times. And again, that's something that's managed on a local school level. All schools are required to teach children the relevant hours of teaching time, and that's the same regardless of a school that might start early or finish early. I know of some schools in Western New South Wales, for instance, who do tend to start a bit earlier and finish a bit earlier due to the heat of the day out there. So,
Minister, what I'm asking, sure, that goes on. But right now, this week, to what extent is that going on because of the COVID situation and effects on staff?
Yeah, look, I've not received any advice that there's been any impact to normal school operations in terms of our COVID issues or staff being out. As I've said, the number of staff that we have out are being covered by our casual staff, by normal timetables, and there hasn't been any indication to me from our department that that has been an issue in any schools.
And on the plan, on the plan in terms of rat tests going forward,
Yep.
may it be school-based? Looking ahead rather than home-based?
No, look, I think the home-based testing is working very well, and I think the reality is for most families, it's a small price to pay. It's something that you do each morning, or 2 mornings a week, I should say. Something we're experiencing in my own household, and so the at-home testing kits work well. I guess the question going forward is, what is the take-up from families? What do we see in terms of case numbers in our school and our communities? They're the kind of things that we'll be considering over the next week or so as we determine, as I said, what happens from week 5 onwards in the school term. But certainly, we've been using rapid antigen testing kits in schools when we used them last year, when we had a test-to-stay approach, and this year, the at-home testing regime is what we will be doing.
Is that surveying attempting to, among other things, identify the fact that many of these tests may not be being used?
Well, that's one of the questions. So one of the questions is asking parents about how many of the tests you've used. If you have used them, what are the reasons why? If not, what are the reasons why not? And also, what's the experience been like for your children? So as I said, it's a very simple survey, 7 or 8 questions, but it gives us a chance to get that feedback from parents and use that to help inform our next steps when it comes to our school settings and the use of rapid antigen tests.
I just want to make a further comment in relation to what Sarah's saying. Well done, Sarah. Let's focus on the positive here. If we go back a few weeks ago, we sat in press conferences where people said bringing kids back into the classroom couldn't be done. There was concerns about closures of schools. We had the doctors' union who were still coming out and saying we shouldn't have kids back in the classroom. What I saw this week was smiles on so many kids' faces right across the state as they returned back to class. We went out, we had a plan, we resourced that plan, we executed that plan. We always said throughout this period of time that there would be bumps along the way and there will be challenges. There is no doubt about that, but we're in a pandemic. The alternative that was promoted by the opposition, promoted by the doctors' union, was to close schools. We said no, we put a plan in action. There will be challenges, there'll be issues from time to time, and perhaps in certain cases school may need to start early, maybe it needs to be held back. We have over 3,000 schools across our state. We resourced every single one of them. I was out in far western New South Wales just yesterday and met with teachers and spoke with them about their experience. And they have their kids going back, and as Sarah said, some kids actually go back next week, and because of the heat, they'll be going back next week. But we know, and we set out to achieve this because we know the importance of having kids back in the classroom. And to see all those smiling kids and the excitement of them going back and seeing their friends after what has been an incredibly disrupted 2 years. We've seen other states delay the return of school. We've seen other countries around the world close their schools. But we're not doing this. There will always be challenges. I accept principals may have concerns from time to time, and we and Sarah will continue to work with them through this. But I believe what we've achieved this week has been significant. I want to thank our teachers for all the efforts they've put in place. There's been challenges and there will be more challenges. But to be in a position after 1 week to have so many kids back in school, to have so many teachers looking after those students and doing what they love, and that's passing on education to the next generation, has been incredibly pleasing. And I'm incredibly proud as Premier of the state of what our parents and teachers and children have achieved this week.
On the CBD,
yep.
When are these Friday vouchers actually going to be available? And is the idea of public transport being free of the possibility?
Everything's a possibility. I mean, we had...
But it was last year, so we need some action now.
Well, we put incredible plans in place over the previous 2 waves when it came to the Sydney CBD. We held 2 summits, got a whole lot of ideas together in terms of events, festivals. I'll get you the date on the Friday voucher. That will be with customer service, but I know we deferred that because of the Delta outbreak, so that would have been in last year. But during the concerns during lockdown in Delta, we postponed the release for obvious reasons because you couldn't go out. So we will time that with getting the Sydney CBD going again. Obviously, at the moment, we have recommended that as we move through getting kids, so take a step back. two things I have said in terms of our priorities going back a couple of weeks. Firstly, getting kids back into school, and secondly, bringing back non-urgent elective surgery as quickly as possible. We didn't want anything to impact on that. So as a result, there's been some restrictions that have remained in place. They are proportionate to the situation we find ourselves in. One of those has been, if you can work from home, please do so. So that remains in place. Now, what we saw, and as previously serving as Treasurer of this state, on both Alpha and Delta, once you move through that period of time, people go back into the office. It's boom time in the Sydney CBD. I saw that late last year. We saw significant attendances. It was coming back, and that's incredibly positive. I feel for many of those businesses, I know businesses right across our state have done it tough during this pandemic, but so many of those smaller businesses in the Sydney CBD who rely on tourism, for example, predominantly for their survival, they haven't had that for 2 years. So past performance is the best indicator of future performance. We will invest whatever it takes to get our Sydney city thriving again, and it's not just the Sydney CBD, it's Parramatta as well. Those two great cities in our state, we want them back in action as quickly as possible. I want businesses to thrive again. I want people back in the office, but ultimately it's come down to priorities. Our priorities: kids back at school, bringing back non-urgent elective surgery. But I am completely confident the Sydney CBD will be thriving again as it was post-Delta last year. It's exactly what happened again. Increases in case numbers, confidence declines, case numbers decline, confidence rises. That's going to bring activity and action back to the Sydney CBD and Parramatta. Let's not forget Parramatta here as well. Parramatta is also in the same boat as the Sydney CBD.
Last one, please. Domestic tourism. Are we seeing an uptick in domestic tourism since restrictions have eased on travel internally? And also, when are we going to get cruising back? People are going overseas to take cruises, taking money overseas.
Well, it's something that's been around. So I'll get you in relation to your first question. I'll take it on notice and I'll get you the answer because I don't have the tourism numbers in front of me. In relation to cruising, well, as soon as we can, as safely as possible. It's an industry that's done it incredibly tough over 2 years. It was discussed last year at the National Cabinet a number of times prior to Omicron, and obviously that's probably delayed it, but it doesn't make much sense that you've got people leaving Australia to go cruising overseas and not being able to cruise in Australia. So it's like any of these businesses, we want to obviously get that back on track and in action as quickly as possible. A lot of it relies on the federal government. It's a federal and state government issue, and I'm sure it'll be a topic of conversation at National Cabinet as we move through this period.
Dr. Chant, just quickly, obviously we've just gone through this wave over summer. The Chief Medical Officer yesterday warned of the flu also likely to spike this winter. How concerned are you about the combination of a flu spike and also the fact that we could have another wave of COVID at the same time?
Look, I think we need to approach 2022 with a degree of optimism. We've got vaccines that are holding up well. We'll have further vaccines throughout the year. We've got antivirals, and we also really know what tools we have to slow the spread or stop the spread and provide protection for you individually. So I think that whilst we will see challenges ahead in the year, we will see waves, so we will expect to see case numbers come down, but as immunity wanes, we may well need to see an uptick in cases. We may need to revaccinate some people that are particularly at risk of severe outcomes. We need to do planning for flu. We've had 2 years without flu, but it's really positive that some of the tools that we've used to fight COVID, like good hand washing, mask wearing, staying at home when you're sick, will also be good and effective interventions against flu. So yes, we're watchful, and we're planning now for a flu season as you'd expect. But again, I think we should be increasingly hopeful as we go through 2022 that we know and have the tools available to combat whatever comes. and expect the unexpected, but let's approach it with a degree of optimism.
Thanks, everybody.
Right on.